to highlight the crisis faced by families dealing with mental health issues, particularly those with children. The crisis brought to my attention by many constituents over the time I've been an MP. But today I would like to raise the issue of my constituent Stephanie. Her son is autistic, non-verbal and has complex developmental and communication delays. Stephanie knew that her son needed an ADHD diagnosis from an early age. She was told that he could not be diagnosed until he was 7. When her son did receive a diagnosis, Stephanie was told by the doctor that it was obvious how much he was struggling to cope with his life due to his ADHD. He is suffering from elevated levels of distress and inability to sleep through the night due to his inability to sit still for long. Sadly, Stephanie was then informed that it would be an 18 to 24-month wait for the community service MindMate to sign off on the diagnosis and refer it to CAMHS, along with the medication plan. The CAMHS wait would then be a further 18 to 24 months to receive medication, meaning if they hit largest waiting times of both services, and would have been told he needed medication at 7 and receive his prescription at 11. Long wait times for diagnosis and medication mean that families across the country turn to charity support groups for help, such as Zigzag, which is based in my constituency. It's the Leeds Autism Support Group who offer essential advice and support to thousands of families across Leeds. Stephanie has expressed her concern and garnered support from other families with similar experiences. The situation is at crisis point and requires immediate attention from the government. We cannot ignore the struggles faced by families across the country dealing with complexities of mental health issues. It is the responsibility of the government to ensure that our most vulnerable citizens have access to prompt and proper care. Those issues are just the start. For instance, Leeds University reporting they've seen around a 60% increase in demand for mental health services, and the issues are a lot more complex than before COVID. They advised that many students arrive at university with anxiety and mental health issues, as the support they needed in their formative years was simply not available. We're just building a huge pressure, like a dam that's going to burst. Adult ADHD services in Leeds currently have 3,300 people on their diagnostic wait list, and that doesn't include all the people that can't even be bothered to go see their GP because of the length of the waiting list, and are receiving more than 170 referrals per month, far exceeding their capacity as a service. Their waiting list is currently upwards of 3 years, with an added wait for medication once they receive diagnosis. Similarly, the adult autism diagnostic service in Leeds currently receives more than 100 referrals per month, but only have the resources to complete 40 assessments per month. The current situation is completely unacceptable, and we need the government to create a more effective and efficient mental health care system that responds to the needs of communities. We cannot continue to let families like Stephanie's down at every turn. It is crucial that we invest in the mental health sector and prioritise the well-being of all of our young people. Thank you.